Okay, good morning, everyone. We are here with, I call her Captain Shalanda Williams, because that was her rank
Hello.
when she left the Army. Our
Yes.
officer in residence, West Point graduate. Thank you for your service, as always. And you're
Thank
doing a
you.
great job with us at Triad, and we're making these YouTube videos for our channel so that if you're a prospective client, looking for a clinician, this will help you make a better and informed choice getting to know our different staff. So with that, we're here with Shalanda Williams. Shalanda, tell us about yourself.
Hello. Well, thank you for the introduction, Dave. As you said, my name is Shalanda Williams. I am a West Point grad of 2015, graduated Liberty University with my master's in mental health in 2023, and then got started, as a counselor from there. So after my experience in the military, I knew I wanted to go in a different direction. And so mental health counseling is always something that, appealed to me. I couldn't necessarily articulate it at the time, but I knew that I was, drawn to it. And so after getting my master's, I was able to find an internship with a substance abuse center. And that really opened my eyes to a completely different world and from a different perspective. A little bit more personally, I don't necessarily have a background, or I don't have immediate family members who have struggled with substance abuse, but yet my heart was drawn, to that particular, group, especially minim or marginalized group, in a different way. So through that internship, I was very grateful to experience that and to support them in a way that sometimes their own community doesn't even know how to do. So that was a great eye opener. And then transitioning into private counseling with Triad Psych now, I've been able to experience other populations as well, including neurodivergent individuals and children, as well as married couples and individuals just dealing with different transitions in life. So it's definitely been a journey, although a short one, but I definitely look forward to, what's to come as, I continue to mature in Triad Psych.
Yeah, you've come in, you've hit the ground running in a great way. Um, you have a very loyal following of patients. I don't think there's never even been a single complaint against you. And, in the psychotherapy in the world of private practice, that's rare. There's usually somebody who gets upset or, feels you did something wrong. We've never had a single complaint at all about you, which is terrific. And, exactly what you do, I'm not sure. What I do know is, even though we have excellent soundproofing in the Marietta location, I hear a lot of noise coming from your sessions, a lot of whoop, whoop, and laughing and energy.
Mhm.
And, when people say, well, tell me about Shalanda, I constantly say, well, she brings a lot of energy to the table. That's for sure.
Mhm.
These are not boring, drawn out, monotonous sessions. Now, what you're saying to them, I don't know. That's where the soundproofing comes in. But I can hear the laughter, I can hear the excitement and the joy. So how do you bring so much energy to the table?
Mhm.
Or to the session, I should say. To the session,
It
yeah.
differs from client to client, every person is different. And so especially initially, I try to get a feel for the client's goals, why they're in therapy, what was their intent? Did they, intentionally search me out, and if so, for what reason, or what led them to therapy in general. So it really depends on the client. But ultimately, I do try to maintain a position of hope, that things will get better and that their situation will improve. And even as we work through the solutions or how to overcome, it's a process and a journey that we can do together rather than them having to go it alone. So I try to maintain, from that stance, especially as a Christian counselor, knowing that ultimately our hope, lies in Jesus Christ. So that's always the basis. And it helps me even in situations where I don't necessarily know what to say or don't necessarily have an answer, to give to clients. It's something that we can discover together as we seek to draw closer to him. So
Does your, we're going to cover both those points. Does your training as an officer at West Point, does that play into this at all? How does that training go? Because we had a clinician with us who was a former Marine years ago, who was for many years a drill instructor in the Marines. And, we were wondering, was this going to be a good fit, especially with our neurodivergent clients? And it turns out it was an amazing fit. That, a drill instructor doesn't just have people do jumping jacks. They're trained to form cohesion within the group. So especially her groups were very high energy. And I said, well, what framework are you using? She said, I'm just pulling everything from the military, but it worked so well. But so does your training, does your West Point training play into this work?
I would say yes, absolutely, but not necessarily in an intentional way, because that was time spent, and that will always be a part of me. I know that that impacts the way that I process, the way that I interact, and that will never change. But am I intentional in, okay, I saw this in the military and let me implement it here? No. If anything, I am consciously, trying to do that in terms of what I learned in school, but often, and especially moving into other clients outside of just the substance abuse being the focal point, I've had to pull more so from experience, hence why, supervision and even time and different conversations with you and our other coworkers have helped me to kind of get a grasp on current situations and not just go by the textbook, because it does leave a lot to be desired. For
sure. So let's pivot to your Christian orientation and your Christian faith. I came into this field by studying philosophy, and psychology is just an offshoot of philosophy. That's where psychology comes from. And there's certainly the modern psychology, the Freudian work as well. And, to me, the Bible, regardless of whatever Old Testament, New Testament, whichever one you're using, is as much a book of wisdom and philosophy as it is anything else. So how do you integrate that into your therapy too?
Well, once again, that's something that is a part of me. So in terms of my identity as a believer, that is something that will never change, no matter the client that I'm sitting in front of. To what degree that I guess more openly or more directly speak to that does depend on the level of the client. But as far as how to direct, and like you said, in terms of being place to seek wisdom, that's where I do and try to do on behalf of my clients as well, because I don't know everything. And there's a lot of situations that are presented or discussed about in my sessions where I don't have an answer, and I definitely don't have an answer immediately. So that is where I try to be intentional to fall back on the word, because there are certain things, even as I find as well, where my clients won't necessarily reveal all things up front. So certain things are found out by session, or by month, or sometimes by a few months, and certain things are, as they're sharing, I can see, and it's more easily revealed. So that's always a part of me. And I try to integrate it, at different levels, like I said, to the client's comfortability. But in general, anytime they're sitting in front of me, they're sitting in front of a believer.
Okay. And if someone does not want a Christian perspective brought in, you can do that too, your counseling, correct?
I'm not good at that, no.
Okay.
I mean, I try to be open, but in all honesty, no.
So it's really a big part of the practice. So patients need to know that coming in too.
Yes.
Absolutely. Okay. Very good. And what does an ideal patient look like for you?
An ideal patient? I have, several, and I'll start with individuals. So generally with age, I will say, and not to say that 14 is a hard number, but in terms of that, that's often where I find a lot of the identity starts to get formed, and we're going through this process of what kind of person do I want to be? How do I want to be perceived by people? At what level, do I value other people's validation over my own? Do I know what that looks like? Do I value my parents' voice over my own? So that's where I really start to find, those formative years, starting at around 14, especially with young girls who I've, had the pleasure of working with a lot. And I really enjoy that age. 13, for some 13-year-olds, they can be advanced, but really around 14. And then up to, I would say 30s, but it can go beyond that, because I do have some older clients as well in their 40s who are still kind of experiencing transition. So having to deal, especially at that point, and not to say that my younger clients don't either, but as they get older, dealing more with grief and what that looks like on a daily basis, or dealing more with, marital struggles, relational issues, another form of identity, especially as, older men and women have children that are leaving the nest. So what does the empty nester look like, and how to kind of like the song, let me reintroduce myself, how to do that and appropriately and in a way that's healthy, and able, just sustainable for the client. So in that regard, I would say 14 to like 40s. I do enjoy working with, different people of color. That's always a favorite, but it's not limited to that. I just understand that, I have to learn the client. And even in, working with people of color, I very quickly realized we are not all the same. And there are many differences that I have to not only be intentional about, but learn to celebrate. So it's a learning process as well for me, just as much as it is for the client. And doing my best to make sure that I can reflect back what the client sees and some, blind spots as well. As far as couples, I do enjoy working with married couples. And I enjoy that because I truly believe that marriages, and families are the backbone of America. So in terms of, if I want to see change, it has to start with me. Even in terms of the building block of our nation, it rests on healthy families. And so anything that I can do to help get there in the midst or prior to me getting married, and even after, marriage and that kind of transition, I want to be able to help. And so that's the way that I've found that I've been able to be, more effective.
Right. And you beat me to the punch on that one. You do a lot of couples work. So how do you approach couples work? How does this work for you? What's your orientation to it?
So the basis, and it's not necessarily a therapeutical approach first, it's more so this can work if you work it. So that's often where I find, certain couples, it's one client who is all in, maybe, definitely to an unhealthy extent where there's little to no boundaries. And then one client who's just kind of like, given the bare minimum. And that dynamic can switch, it can change, and it's not necessarily dependent on the wife or the husband. It looks different for every couple. But two, I often find that there's a lot of unforgiveness and resentment. So in terms of even just being willing to come into the table, when I see clients who years and years of unspoken hurt, unconfessed resentment that has now cemented into bitterness. And that's even going with Gary Chapman's work, like how he talked about the four horsemen. Contempt.
I thought it was Gottman. I thought the Four Horsemen was Gottman.
I'm sorry, Gottman.
That's what I thought,
Yes.
yeah. I was about to ask that too. What's your opinion of Gottman? You keep, you've got to stop beating me to the punch in this interview. I can't ask but now run with how you utilize the Gottman work. And for people who don't know that, Dr. Gottman and his wife really revolutionized couples in marriage counseling, because he turned it into a hard science, which it wasn't up to then. That my mother, who I was inspired by, who was a psychologist, was not a fan of the marriage counseling movement at all. It came out of the 70s, and it postulated that there's no diagnosis present, everything's just resolved within the couple. But she never felt it was a hard science. And when I learned Gottman for a contract I worked on, an EAP contract, I said, OMG, he turned it into a hard science. We now have data that can really work. So talk about Gottman a little, because a lot of people don't know about his work.
Okay. So my main focus with Gottman is the four horsemen. And primarily with that, I know it's stonewalling.
Right.
I'm sorry. Oh, stonewalling, contempt, and there are two others. I think
it's criticism, contempt, stonewalling, and
defensiveness.
Defensiveness, you got it. Yep.
Okay, got you. So all of those are always present, unfortunately, with the clients that I have experienced. And so oftentimes, And unfortunately, there are times when, they may feel that a conversation is a little, too little too late, which it's not. But after attempt to reconcile, fail, it gets stuck in a cycle. And so while, yes, the solution does lie within them, it often has to be presented on a different level outside of them. And then they take it and run with it and make their own. But those four horsemen, he was absolutely telling the truth with that. And it's unfortunate that, those are like the kind of like the locusts that come and, eat up the crop, if you will, of it can really spoil years of otherwise great companionship, great memories, a life well lived, children raised. These things come and eat up the good crops like locusts. So he was definitely right, with that for sure. And I see them present in almost all of my couples.
Right. And he talked about the significance of eye rolling, and eye rolling type behaviors too is very bad for a relationship. And it doesn't always have to be eye rolling. It could be like or a grunt or something that comes out. It's a way of showing frustration or disdain for your partner. And it tends to lead to much bigger conflict. So if you can get a couple to not do that, to not roll their eyes at each other, to not this, body language as well makes a big difference. That's great.
Yeah.
Let's also talk about, you're very passionate about working with veterans. Let's talk about your work with veterans because you are one.
Right. So that is an ongoing process, because even when I think about my personal time in active duty, and I was stationed at Fort Campbell, and that in itself has some of the most famous, units, a lot of, older, more seasoned, military people, and soldiers in general. It was still a stigma, even though, it was getting better. It was still a lingering stigma of you don't talk
Even
about your problems.
getting mental health services. Yeah.
Yes. Like you don't talk about those things. Like acknowledge, it was like PTSD definitely acknowledged, but more so once you got out as a veteran trying to get 100% being totally transparent. Before then, as a soldier, especially active duty, mm, it was there, and it was necessary when you wanted to get out of stuff. And not to say that people would always abuse it in that way, but it has and it was, abused. And so now on this side, to start walking through some of those memories, I even have a client just in terms of it was work to help him identify, okay, what specific events are causing you to feel stuck? Like, why do you, anything from reoccurring dreams, the same type of dreams, to where at this, at a certain point, it becomes arrested development. And so when it comes to transition into civilian life, which is very difficult for veterans because active duty or even reserve, it's not the same. There's a different understanding. There's a different camaraderie. There's a different level of expectation that as civilians is not there. And a lot of times out of like concrete businesses, even that framework can't support that level of camaraderie or togetherness, if you will. So it's been an adjustment personally, as well as seeing other veterans. I know, it's an adjustment for them as well. And it's nice to have retirement. It's nice to have your needs taken care of. But unfortunately, the VA can often add frustration too, just because
We
of
deal with that a
how
lot. We
cumbersome.
deal with that a lot. You and I shared a case, and a good chunk of this patient's problems were because of VA red tape. And it was causing him depression, agitation, anxiety, acting out behaviors.
Right. And that's still the case. And so as, great as the VA can be, when I think of the slogan, be all you can be, I wish it was the case for the VA. And at times where they shine, they definitely have their times when they drop the ball. And what, I see personally in therapy is that it's the people that pay. Like when I think of a drop ball, it's not just a metaphor, it's the people that don't get the care that they need. So working with veterans is definitely, it's not for the faint of heart, for sure.
Talk about the role of community with veterans.
It's necessary is not a strong enough word. It's a
It's
dire
vital.
need.
It's vital.
Yeah, it's vital. Yeah, it is a dire need because you need other people to help regulate. Like when I think of community in terms of the bowling lanes and how you have the little lanes that they pull up for the children. That's what community helps you to do. So in addition to your relationship with God, your relationship, with close family, you also need, a community at large to help watch your six, so to speak, but not just your six, all sides. Because, hey, this is where we're going, or we have similar goals. Yes, let's unite and conquer this together, such as a three-stranded cord is not easily broken. Or, hey, you're veering over too far here, you're drinking too much, or smoking too much, whatever, vice versa. And then watch your six. Hey, I noticed, you started giving stuff away. I noticed you started talking about, the end times, little signs that, with community, they can be caught versus isolated. You're on your own. And that's not a good place to be.
Absolutely. Okay, thank you so much, Shalanda, and those of you out there in YouTube land. We hope this was informative and educational in helping you making a choice or a decision. And if you need us, just click on our website, triadpsych.org, and we're going to tune out from you. Thank you so much.
Thank you. Bye-bye.